Well, hello, everyone. Welcome. I'm Susan Weinstein, Co-Executive Director at Families for Depression Awareness. Welcome to our Caregiver Conversation series, where we address issues of concern to caregivers of people living with mental health conditions. Thank you for joining us. Today, we're talking about Telemental Health, a service that's become increasingly accepted and accessed, particularly since the start of the COVID-19 pandemic. Please don't hesitate to join in and ask your questions through the comments. For those of you new to us, Families for Depression Awareness is a national nonprofit organization that helps families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. Our website at familyaware.org is bursting with educational content, resources, and online tools, all designed to equip family caregivers, whether that's parents, adult children, siblings, or others, to help their loved ones living with mood disorders. We were founded in 2001, and we're thrilled to be celebrating our 20th year of helping families. It is now my pleasure to introduce Dr. Nicole Christian-Brathwaite, and I will make her come out too. There she is. Dr. Christian-Brathwaite is a nationally recognized board-certified adult, child, and adolescent psychiatrist. She is the CEO and founder of WellMind Psychiatry and Consulting Company, and the Senior Vice President and Medical Director for Scheduled Care and At Home at Array Behavioral Care. Dr. Christian-Brathwaite has experience in perinatal and postpartum mental health, trauma-informed care, telepsychiatry, how useful for this, mental health in communities of color, school psychiatry, and implicit bias and racism in mental health. After graduating from the University of Pittsburgh School of Medicine, she joined the Adult Psychiatry Residency program and then completed the Child and Adolescent Psychiatry Fellowship at Massachusetts General Hospital, McLean Hospital. Lucky for me, Dr. Christian-Brathwaite volunteers with Families for Depression Awareness as a member of our board of directors. So thank you so much, Dr. Christian-Brathwaite, for spending time with us today.
Thank you for having me. And I feel like Nicole is just easier than my very long last name. So
I didn't want to presume, but I did wonder how much time we would spend on that.
It might as well be a tongue twister, so it's fine.
Please feel free to call me Susan. Before we go on, I just want to tell people that if they want to ask questions, they should throw it into the comments and we will get to them as soon as we can. So let's start off with this. Could you please describe the work that you do?
Sure. So I'm a board certified child, adolescent, and adult psychiatrist. So essentially that means I provide mental health care to the lifespan. So little ones like 5 and 6 year old, teenagers, transitional age, youth, adults, and then even a few people older than 65. So I provide mental health care, therapy, psychiatric evaluations to determine if people need medications, and if they do need medications, offering that service. Much of my work I do via telehealth or telebehavioral health, meaning that I see patients in different locations. So I see patients in a clinic in very, very rural Illinois. I see some patients in their homes. I work with the Division of Youth and Family Services in Illinois, and I see patients through that group. And so through the different locations, I am able to see people all over the country because of telehealth.
And is that different than pre-pandemic?
Well, I had actually been working in telepsychiatry and telehealth for the last couple of years. So my job hasn't changed that much, but my small private practice that I have here in Massachusetts, that ended up transitioning more towards telehealth because of COVID. Prior to that, I was seeing people in my office. So that's the biggest change. But I was also, most of my patients were via telebehavioral health.
You were ahead of the curve.
Right. Yeah, I know. I was thinking I'm in the right industry right now. So yeah, it certainly worked out.
So let's just form a basic platform. How do you define telemental health care?
Sure. And, I think people are nervous about it because it may seem new or unfamiliar, but really it's just simply delivering mental health care via a video setting, or sometimes either even via phone, excuse me. And the most important part is that we're able to deliver this care through video, and that both the clinician, the doctor, the therapist are in a private place, and our client, our patient are also in a very secure and private place.
Did it used to be that, have you always been able to talk with people in their home? I know for some types of insurance or medic something, they had to go to a facility to have a conversation. Is that right?
Yes. So there certainly have been a number of changes in terms of the regulations and restrictions around telemedicine in general, but even more specifically, telepsychiatry or telebehavioral health. Prior to COVID-19, many insurance companies were not willing to cover seeing a patient in their home, either having the provider, the doctor, be in their home or the patient be in their home. So there were previously requirements that both people had to be in an office, or at the very least, the patient had to be in an office setting. But because of COVID-19, even going to a doctor's office for some people was just too much risk. And so insurance companies have agreed to reimburse the same visits while people are at home. And they're also now reimbursing for phone visits as well.
So it seems like it's really, it seems like the powers that be, whether they be insurance or government regulators, have really helped move telehealth forward.
Absolutely. And, I'm glad. It's unfortunate that COVID-19 had to happen for these advances to take place, but it really was due. And the services support and help so many people, and so many of those restrictions weren't really helpful, and if anything, were preventing the delivery of care. So I'm glad that many of those barriers have been brought down.
Me too. I think it's been really fascinating to watch, and how so many people have transitioned well to being able to have conversations with their providers from their homes, or if they're still going to an office, then sometimes there too. But as a psychiatrist, not all psychiatrists do therapy, right?
Sure.
But you are one who does.
Yes, I see every interaction as a potentially therapeutic interaction. So even in my 30-minute medication follow-up visits, I'm doing therapy. So we're looking at coping skills, because I always tell my patients that there is no magic pill. There is no, you take this one thing and it fixes everything. Medication is a piece of the entire treatment pie. And, sometimes it's 20%, sometimes it's 40%, but there's so much more that needs to be done outside of taking medication, including problem solving skills and coping skills and stress management and processing trauma. And so even within a short 30-minute visit, a lot of that work can be done in that setting. So I always try to do therapy in any interaction.
Yeah, it's kind of a bummer that it's so much work. There's so many other conditions that you do have the medication and it takes care of it. You don't have to put all the mental and emotional energy into it, but I hear it's worth it.
Yeah, it is. It definitely is.
So I think that you mentioned some of these, but in terms of the benefits of telemental health, I have read that it's been really good for the providers in that people keep their appointments much more.
Mm-hmm. Yes. Yeah. There are so many benefits. Even thinking about if you were a new parent or a pregnant mother, I remember when I first had my kids, just the thought of going to a doctor's appointment and having to pack them up, bundle them up, put them in the car seat, carry the really heavy, and my kids were humongous. They were both like 10 pounds when they were born. So they were just like always like just over the top humongous. And so carrying them, I always had like, I felt like my shoulder was going to die. And just thinking about doing all of those things just to get to an appointment. They may or may not cry during the appointment, or I have to take them to someone else's house. It was such a barrier to getting care, to accessing care. But with telehealth or telebehavioral health, I have a focus in perinatal mental health. So plenty of times I'm talking to moms and the babies are right there with them, or the baby's in the next room taking a nap, and we actually try to schedule the appointment around nap times. So that level of convenience is so much better than, in the middle, right after the snowstorm and the roads are icy and trying to get to an appointment. So telehealth provides increased access to people, not just where it would be inconvenient, but there are many areas where there really are no psychiatrists at all, or you have to drive 30 or 40 minutes to even access a psychiatrist, and maybe there's like a 6-month or 12-month wait. It also opens up options. So when you're looking for a behavioral health provider, you're looking for people in your community. So who is accessible via train, or who can I get to maybe during a break at work? But with telehealth, the person, your psychiatrist or your therapist, doesn't even need to live in your city. They just need to be licensed in the state where you're licensed. So again, I see patients in Illinois, and very, very rural Illinois, completely different from where I live in Boston. But through the nurses I work with and my patients, I've learned about their community. I've learned about where they live in Illinois. And even though I've never been there and I'm halfway across the country, we've been able to build this connection. I understand their culture. But again, they only have a psychiatrist because of telepsychiatry. Otherwise, they didn't have any access. It was very rural, and it was hard to recruit psychiatrists into that community. And so, just thinking about ease of access, and again, the decreased risk of missing appointments because it's so much more difficult to get out of the house, it overall improves the quality of care and certainly can improve outcomes.
And so we're believing that it is as effective as in person.
Yeah, absolutely. There's plenty of evidence showing that in some cases, telepsychiatry may even be more beneficial, but at the very least is equal to the care that you receive in person.
Good to know. Are there mental health conditions that don't fit for telemental health?
There are very few mental health conditions where I would say I would not feel comfortable evaluating a patient or treating a patient via telehealth, but it also depends on the setting. So my company, Array Behavioral Care, we have clinical settings, throughout the country, in outpatient, inpatient, emergency rooms, residential facilities. And so, for example, in an emergency room setting, there may be an individual who comes in expressing unsafe thoughts, or who may have recently had an attempt, but they're in a safe setting. There are nurses around, doctors around, and then the psychiatrist can see that person, communicate with the medical team, and come up with a plan. Even though there certainly are safety concerns, at least we know that person is in a safe environment, and they can still access the psychiatrist even if that person isn't there. So there are very, very few limitations. Some limitations would be, of course, if someone wasn't comfortable with using video, didn't feel safe using video. It is very secure, and most places are almost all places, frankly, are using HIPAA compliant telemedicine technology. But for some people, using the technology is just overwhelming for them. But that's not even necessarily a specific illness. When I'm seeing patients in their homes, my biggest concern is making sure I know where they are. So making sure they are in their home, or they are where they tell me they are, in case there is a safety concern, or if I do need to contact a family member, or if I do need to send someone to their home, I just have to know that you're in a safe place, or that I can access you, or someone can access you if there are any concerns. But otherwise, there are very few exceptions.
Okay. We've got a really good question from Gwen. So thank you, Gwen, for sending that in. It says, how do you connect with and engage kids or teens with depression or anxiety through telehealth when they don't really want to participate in a conversation with you? Is it harder than in person or easier because they can do it from home?
Yeah, that's such a great question. And I love working with teens and adolescents. They're so honest, and they're also pretty challenging, and they are very good at reading when things are not true. And so, one of the things that I really try to do with teenagers, whether it's in person or via telehealth, is to just be very transparent and obvious and honest. So if they don't want to be there, I state the obvious. You don't want to be here, but you're still not doing well in school, and you're still sad often, and everything irritates you and everything frustrates you. So you don't want to be here, but there's still these lingering things that are really impacting your quality of life. So one of the most important things is, to be obvious, but also ensuring that you understand and connect with the teen. It's much easier to get a teen to walk 10 feet to a computer than to get them to get into a car, get dressed, put real clothes on, and drive to an office where they may even be afraid of the stigma of someone seeing them walk into a psychiatrist's office, or afraid that someone will recognize them, when at least in their home, this is their safe place. This is where they feel comfortable, and it's kind of on their terms. I also actually like to utilize the home environment. So I've met cats, dogs. I recently met a snake. I've met a few geckos, a couple guinea pigs, certainly a lot of fish. And so because I'm in the patient's home, I actually have a window into their world in a way that I wouldn't otherwise. I've seen the art on the walls. I know who all of my teens have crushes on, because I see the big pictures. And so it allows us to have a conversation beyond just the mental health. So I'm getting to know who they are. Oh, okay, I see that you're still a fan of Lord of the Rings. Who's your favorite elf? And we're able to talk about those things, and it opens up, and they're able to let their guard down. But because I'm in their home, and because I have this window into their life, I'm able to make really special connections.
I can remember that I was listening to a discussion early on, maybe we were 2 or 3 months into this, and some of the child and adolescent psychiatrists were saying that it was a real benefit for them to be able to see in, because they could see the kids' interactions with others. They could see how what their environment was like. So yeah, absolutely the same thing.
Oh yeah, I mean it's certainly, and again, I consider it to be a gift and a privilege to be in anyone's life in any way when it comes to mental health treatment, because that's a very vulnerable place. But then even more so, people allowing me in their home, inviting me into their home, it's very special.
Speaking of being in the home, well, I guess a couple of things. One is, do people have to have any special technology to be able to engage in mental health?
So and I think that in terms of limitations, that's probably the biggest limitation, is just access to good internet, or access to a smartphone, a tablet, or a computer where you can do video calls. Certainly, I have plenty of calls where someone has their phone down here, so I'm mostly looking up into their nostrils, but at least the video is there. But for people who they have kids at home, and everybody's using the internet, and the bandwidth just really isn't that great, and so then it leads to the video pausing, or I'm missing things that they're saying, and that is certainly very frustrating. So having quality internet, or having access to Wi-Fi, tends to be one of the biggest limiting factors. As I said earlier, insurance companies are now reimbursing phone calls for appointments. That's certainly less ideal. We, as physicians and clinicians, want to see the patient. So much We can learn from seeing their demeanor, seeing their posture. Did they do their hair today? Do they look disheveled? So having that visual contact is very important, but some contact is better than none. And so for people that are limited by technology, they're certainly the phone calls are an option, but that certainly can be frustrating, particularly thinking about underserved communities like very, very rural areas where they may not have great access to internet, or in communities where the internet is not great, or to have internet with a higher bandwidth is just unaffordable.
So I have heard of people like going to their cars and things like that, or parking outside the library. But are there things that caregivers can do that can, beyond the technology, but more like a private space? That I was thinking of Gwen's question about how a kid would be less inclined to engage in telehealth if they didn't have a private space where they could have a confidential conversation.
Totally, yeah, totally. That certainly is a challenge. I have plenty of families who live in a 1 or 2 bedroom apartment or a small house, and they're 3, 4. I have a family where there are 8 people living in a very small space. So privacy is almost impossible. And there are a couple of things that we've done. One, if, for example, if a parent or an adult is at work and they can have a private space at work and there's Wi-Fi, we schedule our appointments when they're at work, because that will allow them that privacy, outside of children or other family members listening in. They can close their office door, or their employer has provided them a space where they can go and spend 30 minutes or an hour. For students, I've worked with a lot of schools to pull students out of class and meet with them in the nurse's office because they did not feel safe meeting at home, or they did not feel comfortable having these conversations at home. So I would meet with the kid and then follow up with the parent later to have that discussion. And so there are some ways to kind of get around that. In terms of what a caregiver can do, if you're in a position where it's easier to have the appointment in your home, or you would prefer to have it in the home, if possible, if there is a room where you can close the door, even the bathroom, where you can close the door and have privacy, that would be great. I have some families where when my teen has an appointment, the rest of the family takes a walk, so that because they don't necessarily have a place where he can go and close the door where he feels comfortable. So the family takes a 30-minute walk, or they'll take a quick drive to give him that privacy. Other options.
That's lovely how supportive that is.
No, it is. And I certainly don't take that for granted, because not everyone can or will, but for them, it's important that he feels safe in our conversations and feel that he can be transparent. Again, if you have a place where you can close the door, putting a sound machine outside the door ensures that the person has more privacy, because people aren't able to listen in. I have a couple of kids that will put their cell phones outside the door and play a couple songs, or put on Pandora and the music is playing. And so it's really hard to hear. And then I always recommend people use headphones, because no one needs to hear what I'm saying. And you can certainly speak much more softly when you have headphones versus when you have to try to reach the microphone on the computer.
So one of the things that a caregiver could do to support their loved one is to talk with the clinician about what kind of flexibility they have about where they can meet and what time, so that they could make it work with some of those variables.
Yes, yeah, absolutely. And schools are usually pretty flexible about that. And again, it's the ease of access. Normally, if you have a doctor's appointment in the middle of the day, you have to leave work, you have to go pick up your child, they have to miss school, you have to get to the doctor's appointment, you have to, get a note. Where, again, with telehealth, I reach out to the special education coordinator or the school nurse or the vice principal, explain that we need to have a 30-minute appointment once every few weeks, and we can schedule it at a time, maybe when it's their free time, or maybe when it's towards the end of the day, and then they're not missing that much and they just walk straight back to class.
It works really well. We live in a good time. Despite all of the
I know.
difficulties, there are some real opportunities that we have that people before us did not necessarily. So a flip side of this privacy thing is confidentiality.
Sure.
And you mentioned already that most providers are using HIPAA compliant, which is about confidentiality of patient records. That they're using HIPAA compliant platforms, although for a while it was not a requirement with the sort of like emergency regulations that came out so that people could use telehealth. If people are concerned about privacy, what kind of conversation should they have with the provider about the privacy of their health records and client confidentiality?
Sure, absolutely. And I mean, those are great questions to ask. Although the federal government loosened restrictions around the type of video software that could be used, because a lot of the encrypted software may be expensive or may not be easily accessible to everyone. So they loosened those restrictions so that the treatment could occur. But what hasn't changed is that the doctor or the therapist still needs to be in a private area. They still need to be in a place where they're not being heard or distracted by other people. They still have to use an electronic health record that is HIPAA compliant. So most of those basic standards have not changed. Really, the only thing that's changed is one, being able to use the phone or call patients and being able to bill for those sessions, and using other video technology or software that may not be, truthfully not encrypted, means that there's, always potential, but otherwise many people would not have that access if they weren't able to use some of those other video platforms.
Yeah. So a lot of people, when they're starting on this journey of trying to get care for their loved one, we give them advice about how to find a provider. And often it involves psychologytoday.com, but also knowing what to look for. Is there something different about finding a telehealth provider?
So there actually is, and I don't know if you can tell, but I love telepsychiatry. I love telehealth. It has introduced me to people and individuals who otherwise I would never be able to meet or work with. And I really appreciate that. So because you don't have to be in the same city as your psychiatrist, the options are much more diverse. So again, the psychiatrist just needs to be licensed in the state where you live. And even around the pandemic, there have been some loosening of restrictions around that. For example, if someone is visiting a family member in another state where the psychiatrist isn't licensed, but that's a temporary visit, or when college students briefly go home, the restrictions around where they aren't as significant. But ideally, the patient is in the city. Oh, I'm sorry, my husband's phone.
We're rocking it. Welcome to live, whatever this is. It's not television.
Sorry about that.
No worries. I'm just lucky that the dogs haven't started barking. So
right, yeah, or that a partially clothed 4-year-old hasn't run behind me. So, and the night is still young though, so I don't want to.
Hopefully, someone you know, not some random. We've been told it happens to the best of us, so there you go.
Yeah, no, I mean, I have had a lot of very good Zoom stories, unfortunately. Yeah.
You're now being referred to as DJ Nicole.
I wish it was a better song, at least.
Life of the party. Yeah. All right.
I know. Yeah. But yeah, anyway, again, so, certainly psychology today, there's a new website called InnoPsych, that website was created by a psychologist local to Massachusetts, Dr. Charmaine Jackman, and she created a website for people looking for therapists and psychiatrists of color. But again, when you're looking at these providers, you don't have to look at their current address. You're looking at what states are they licensed in. So it gives you that opportunity that even though someone is, 4 states over, I can still see them. So it opens up the possibilities significantly.
And those same rules apply whether it's a physician or licensed mental health counselor or
Yes.
licensed social worker, blah, blah, blah. Okay.
Yep, absolutely. Yep.
Yeah, we know that finding that for people of color in particular, finding what would be considered an appropriate provider, someone who can better relate to, who might have a shared understanding of norms, that telehealth has been a real benefit there.
Absolutely. Yeah, absolutely. Because it is very difficult to find a provider of color, just even thinking about psychiatrists or even physicians in general. So, for example, African Americans make up about 5% of all physicians. And then if you're looking, for example, for an African American woman, it's less than 3% of all physicians. And so then when you narrow that down to psychiatrists, it's much, much less. So it's very difficult if you're looking for someone that has training or understands people of color, understands your religion, your background. That becomes much more challenging, particularly if you're only looking in your state. So who lives around you. But again, at least there are a few more options if you can, look throughout the country to see who sees people in your state. And, that could increase your options from 2 possible or 1 possible psychiatrist to 5 or 10 possible psychiatrists.
I was just thinking that it's interesting. It's almost a tease, though, because you might find someone who you think would be great, but they're not licensed in your state. But maybe they know someone who is. And
right. I mean, that's the challenge. Yeah.
I was also just thinking that when you look at psychologytoday.com, you put in your city or your zip code, and it tells you who's local. And that's so not relevant right now. So we probably need to send them a message and say they need to think something else.
Update it. Yeah, absolutely.
I'm sure they'll be thrilled to hear from me. One of the things that we talk with caregivers about is that, if they have concerns about their loved one, that HIPAA does not prevent them from being in touch with their loved one's provider and sharing information. Mm-hmm. We always say, don't expect a conversation, but you should be able to relate behaviors, specific concerns, things that the person has said, and just to add to the provider's understanding of the person's situation.
Sure, absolutely. So
how can you make that work with telehealth?
I mean, the same way. There really is no difference. And I always tell, particularly family members of my adult patients, I can listen, but I can't talk. So, everything that you said, I'm happy to receive information, but in the same way that many of these conversations with caregivers or family members happen after the appointment or before the appointment over the phone, it's the exact same thing that would happen with telepsychiatry. Sometimes with teenagers, I'll see a parent's head kind of peek in and just wanted to say hi. Can you give me a call after you meet with them, or can I just touch base with you for 5 minutes? That would happen when I was in clinic face to face, and there's no difference via telepsychiatry. So that in terms of the caregiver communication and connection with the provider, it's the same.
We did a webinar sometime recently. Who knows with our current inability to tell time. I was told every day is Blur's Day.
It really is. It really is.
We did a program on caregiving for someone who is not living with you, who lives far away. And the issue there is that you don't necessarily know who your loved one's providers are. And I don't know how you can really get around that in this situation either, if they don't choose to tell you who they're seeing.
Yeah. And that, I mean, that's unfortunately really challenging because of privacy laws. We can't even confirm if someone's in our care or if we're treating someone. I often will work with my patients to, encourage them to talk to their families or encourage them to communicate, but it's hard. Some people have been hurt. Some people don't feel safe sharing their struggles with family members. And of course, we have to respect that, but it's always helpful to have family and friends contribute or provide support, or just be there when someone's going through treatment.
If people are interested, excuse me, we put up the link to where they can find that Caregiving from a Distance webinar.
Great.
I thought it was enjoyable, but I was part of it, so who knows?
You're slightly biased, but I'm sure it was great.
But just because I wrote it, no. We're very fortunate to have clinicians that we can turn to who review the content that we develop. So got some very good feedback from people, and we got some great presenters from the Howard University School of Social Work. So
that's fantastic.
Yeah, it was good. So I'm recommending it as a must-see for people. Oh, and I just should put in a plug that if you watch this webinar and then do the survey afterward, we will send you a free copy of our Caregiver's Handbook, which is a publication that we had intended to be about 16 pages, and it turned out to be 60. So we were close. But no, it's a tremendous resource, and we're really thrilled to be able to have funding that we can share it with people. So
that's great.
I'll get out there and watch that. Let me think. Is there anything? If people have more questions or comments, keep them coming. How do you know if you have a bad telehealth provider?
That's, I think that goes along with not having a great connection in general with your therapist or psychiatrist. For many of us who do telehealth or telepsychiatry, and particularly if you work with a larger company, they give you basic tips. So, looking at the camera or, making sure that you're centered. So certainly just making sure that the therapist or psychiatrist has the basic video skills, basic technology skills. But no, again, if you're in a room with someone and you don't feel like there's a connection, or you don't feel like they understand you or are taking your concerns seriously, or if you feel like they're minimizing your concerns or dismissing you, that's the case whether you're in person or via telehealth. And so, it really comes down to comfort, a sense of psychological safety when you're in the room with that person, literally or figuratively, and also just feeling like there's a connection there, that person has the expertise in the area where you're struggling or in the area where you feel like you need the greatest support. Ultimately, the technology side of it is so much smaller than the relationship side of it. The technology we'll figure it out, we'll work through it, but the relationship and that connection has to be there.
Can you speak to this? People will stay with a provider with whom they don't have a good connection, or who they feel like isn't doing anything to help them because they feel guilty, or that something is wrong with them, that they're not getting a benefit out of therapy?
So a couple things. One, I would think about how long they've been in therapy. I think a lot of people mistakenly believe that therapy works immediately and that they're going to see an improvement immediately. But therapy takes time. The pain that you're experiencing built over time, and the trauma, the anxiety, all of those things kind of accumulated and worsened over time. Therapy takes time to address those issues. You don't want to be overly aggressive in therapy because that can actually be destabilizing. And so, first, just making sure that people have given the work enough time. When I say enough time, months of time. Also, making sure that you're doing the work in therapy. So if there are things that you have to do, or the therapist recommends that you do outside of the session, that you're doing those things. Therapists are only making those recommendations because when you're meeting with someone, you're meeting with them for 45 minutes, an hour a week. That's a drop in the bucket of your life. Most of the work has to be done outside of therapy. And so you really need to be working on the things that you discussed in therapy during all of those other hours. Now, if you've done all those things and months have gone by, you're doing the work and you're still not feeling like there's any benefit, you're still not feeling heard or connected, be transparent with therapists. Let them know it's not working, because maybe they can just change their approach, or maybe you can have a conversation about what is and what's not helpful, and the therapist can address that. I've had many situations where patients have talked about they feel like their therapist may have an implicit bias or may not understand where they're coming from. But if we're not willing to communicate that concern to the therapist, they won't know. And it's certainly not an individual's job to educate their therapist, but it's important that you're honest with them. Hiding things or holding back or being fearful about being open doesn't help. And if all of that's done and it still doesn't work, look for another therapist. I wouldn't, unless the relationship is harmful, I wouldn't stop the therapy until you've been able to find another provider. But move on. I remember when I had postpartum depression, I went to 3 different therapists before I found one that I was comfortable with, because I recognized that there was something specific I was looking for and someone that understood my experience. And it took 3 different appointments for me to find that person.
And what did you do with the ones you left behind? Just
I
not
told
make
them
another appointment, or did you?
Yeah, no, I mean, I told them I just didn't think that there was a connection there. And that, I was very honest with them.
Were you a psychiatrist then?
I was, yeah. I was in training. I was still in training.
Just checking. All right, so Valerie has sent in an interesting question. What can be done to combat the fatigue of providers of color, with so few of them, and so many of us needing their service? Isn't burnout inevitable?
Oh my gosh, that is such a real question. People are exhausted. Particularly providers of color, we are overwhelmed in so many ways, because one, if you're Black or Latino or Southeast Asian, you're dealing with the day-to-day world and day-to-day life of being a person of color in the US during a time when there is so much tension and so much conflict around race, racism, and race relations. And sometimes it can feel like you have a target on your back. So you have to deal with your own personal experiences in your day-to-day life of racism or microaggressions, and you have to process that. But then you also have to support your patients or your clients who are experiencing that and are coming to you looking for support. And for some people, that can be very triggering. Like, I haven't fully processed the experience that I had today, but I have to be present to support my patients. And so I tell people all the time, everybody needs a therapist. Everybody should have a therapist. I wish there were enough of us where everybody could have their own individual therapist, but particularly for those of us who are helpers, we have to have that dedicated space to process our own grief, our own trauma, our own pain. If not, we're not doing a service to our patients. My grandmother always had this phrase, you can't pour from an empty glass. If we are not rejuvenated and if we are not engaging in self-care practices, who are we helping? And, it's taken me a while even to figure out what self-care looks like for me. So self-care for me is riding my Peloton a couple times a week. And I tell my kids, you are not allowed to talk to me when mommy is exercising. Whatever it is, ask daddy, ask Nana, mommy is not here. These 30 minutes this is my time, and I have to take that time for myself. I love adult coloring. So just about every night I end my day with coloring, and I have, 10 different coloring books. I have like which is kind of like shows that I'm a nerd. I have like a Netter's anatomy coloring book because I just thought that was cool. And then I have, various like animal coloring books. I have African prints, and that is very relaxing for me. And that's how I wind it down from a difficult day. I'm very intentional about what I do and don't watch. I don't watch the news. If the news is on, I leave the room because I know that that's triggering for me. I know it's upsetting, and I need to conserve my energy and my resources. And so as providers of color, one, don't feel guilty to take that time for yourself, whether or not it's taking a vacation and taking some time off and not seeing patients or taking time away from your family. We have to do that. If self-care is actually selfless rather than selfish, because, again, so many people rely on us that we have to be present and we have to take care of ourselves.
That's funny. We call it self-full.
Absolutely.
I'm just curious if you're enough of a nerd that when you color in the anatomy, you use the appropriate colors, or if you like live on the wild side there.
I do. I like to. I like to be adventurous.
Muscles are red.
Not at all. I have like rainbow colors. I made the brain like all different kinds of super cool colors, and the spinal cord is where I really go crazy. So yeah.
Well, you have all those discs you can do.
Yeah, everything. It looks like fingers, and yeah, it's very exciting. I have glitter gel pen, so that's
are a disc jockey.
I am, yeah.
Valerie says, "Thank you for that answer, Dr. Nicole." So let me think. How's your crystal ball doing these days?
Well, it depends.
Okay, so you don't have a crystal ball that you're willing to share, but when we're no longer having these restrictions from the pandemic, what do you think is going to happen with the availability and the payment for telehealth, especially with mental health?
I don't think it's going anywhere. I think many people have been introduced to telepsychiatry, and that's it. They're not going back. This is where they're going to stay.
Providers or patients?
Both. Okay. Both. And when the dust settles and whenever we're out of the acute stages of the pandemic, many people are going to need mental health services for a variety of reasons: financial stressors, the loss of multiple family members. I have some patients and friends who have lost 4, 5, or 6 people in their families, and that's just utterly devastating. And many people are going to need those supports as we try to rebuild so much that has been broken and so much that we've lost over this last year and counting. So I think many of the powers that be, I'm assuming, recognize that mental health services will be a priority and that they will really start investing in that. I know there have been some conversations about expanding residency spots for training. So we need to, obviously increase the number of people who are available. But, telehealth is not going anywhere. I envision it being a part of training now that we're going to start training medical students and residents on how to be proficient in using telemedicine. And I think many clinics are going to offer people the choice. If they want to come in person or they want to do it via telepsychiatry, it's going to be a staple. This is going to be the standard just as much as going into an office was the standard.
From your lips to God's ears. We definitely have long-standing workforce issues in mental health, and since the beginning of the pandemic, our office has believed that whatever we're seeing now is just the tip of the iceberg.
Oh, yeah,
That
absolutely.
these impacts are going to be felt, whether it's grief or loneliness or anxiety or a combination, and the high level of stress that everyone is experiencing, that um, we're really impacting different generations in different ways, and
Absolutely.
the demand is going to be huge. So we can only hope that with so many people suffering, that enough people are willing to stand up to stigma and to be supportive of people who are saying that they need help, or are willing to say to people, I'm really concerned about you. I think you need help.
I will say, I think the pandemic has certainly normalized the experience of feeling overwhelmed and stretched and stressed and reaching your limit. And I'm hoping that because so many people have had this experience of feeling isolated and feeling dysphoric or depressed, that the stigma won't be as great, because so many more people can relate. And so many more people recognize that, you may not be able to see it, but it doesn't make it any less real and any less painful than any other medical illness. And so, I do think that's the one thing to come out of this pandemic, is that people have a better understanding of what their loved ones or friends were going through who suffer from depression or anxiety.
Unless it just leads them to say, I got through it, why aren't you? But
well, yeah, that would be the downside. I'm hoping that doesn't happen.
We keep educating, and we certainly want to encourage any young people who have an interest in helping people to consider going into one of these psychology, behavioral health related professions, because the demand is not going to go away. And hopefully we'll just find more ways that we can help people get through it.
Yeah.
Wow, that's happy. Sorry. Well, it is hopeful, if nothing else. Is there anything that I've not asked you that you think is important for people to know about telemental health?
I mean, I think that the biggest take home is not to be afraid of telebehavioral health, and to see it as an additional resource, an additional opportunity to get mental health care for yourself or for your family member. And there are many opportunities, and it may take some getting used to at first, but ultimately most people realize that this is a great way to receive treatment. I have a couple of 90-year-old patients who don't even know how to use their smartphone, but we've been able to connect via video, and they love it. And they absolutely love it. So they've even figured out how to share their screen on Zoom. So I look at their grandchildren, and they'll show me videos, and there's so many benefits to it. And it will continue to grow, and I'm hoping that more people can embrace it so that they can access treatment.
That's awesome. I don't like the stereotype that older people don't know how to use their.
I know.
Although there are people who get stuck behind cat filters.
That was hilarious.
For people who didn't see, there was an attorney who was involved in a court hearing who had a cat filter that he could not get off. But he did assert that he was not a cat. So that was nice.
That was good to know.
I don't know if you have an opinion on this, but there are companies that advertise, they seem like big teletherapy companies. Are there reasons to have confidence, not have confidence?
I work for one of the largest telepsychiatry company or telebehavioral health company. So from personal experience, I would say I trust and believe in my company, and I believe in the mission to provide care to people who otherwise may not be able to access it. I don't know about a lot of the other companies, but in the same way, when you're searching for a therapist, it's trial and error. So if you engage with a company or sign up and you're not comfortable, maybe they can match you with someone else within their organization, or maybe you look elsewhere. But again, these companies still have to follow the basic rules that in-person brick and mortar clinics have to follow. They still have to have the same standards. Their behavioral health professionals still have to be licensed. They still have to go through background checks. And so all of those same exact things are happening virtually that are happening in person. And so I wouldn't see a reason not to trust telebehavioral health companies.
That's helpful. Thank you. People don't necessarily, it's one thing about having someone in your community who has a reputation that you either know you want to go there or you don't want to go there. But it's a whole nother ballgame when you're talking about these national organizations. So
yeah. Again, it's certainly the unknown, and there's always anxiety in approaching something new or different. But again, I strongly believe this will become the standard delivery of care. And so, might as well just jump on the train. Let's get going.
We don't have to jump on the train. I'm staying at home.
Right, exactly. Just turn
The
on
train
your
can
computer.
just go. I don't need no train.
See, that's a benefit, right? Like no exposure. You don't have to get on a train. You don't have to worry about gas and cold weather, and just turn on a computer. It's so much easier.
Scraping the ice off the car.
Right. Yeah. I live in New England. I feel like it can snow at any moment, even in like May or June. So why leave? Why leave the house?
Well, you've been doing it for a while, so you know.
I know. Yeah. Yep.
All right. Well, I see that we're coming up on an hour. And so I just really want to thank you so much for your time and your expertise, helping us understand more about telemental health. Your experience is really invaluable. And so we appreciate it very much.
Thank you for having me, Susan. I enjoyed it.
And I am glad that you did. I'd
Sorry
also
for the phone disruption.
No worries. As I said, I've been lucky the dogs are still quiet. I want to thank also the Massachusetts Department of Public Health, Suicide Prevention Program, the Takeda Lundbeck Alliance, the Allergan Foundation, and Janssen for their program support for our adult depression program. FFDA's corporate members are very generous in supporting our organization. So encourage you to learn more about them at familyaware.org/corporate-members. And obviously, I would like to thank you, the caregivers and other viewers, for spending this time with us. If you'd like this interview, sign up for our newsletter so that you learn about all of our programs and events. And if you are inclined and able, make a donation at familyaware.org/donate to support our work helping caregivers and preventing suicides. I hope everyone has a good rest of their day or night. And thank you, Dr. Nicole. And we will be back with another conversation soon. Take care.
Have a great evening. Bye-bye.